doc. I was opening my MRE and I stabbed myself in the leg.
This is something I learned from an older medic back when I was in medic school. The medic toss bag is a small, lightweight grab-and-go supply bag that can be literally tossed to injured people to treat themselves or for them to give buddy care. This is useful in mass casualty situations where those requiring care exceed what the number of medical providers present can give. They can also be handed out to people to initiate care while you continue with your triage. I keep these in all my medic bags, vehicle kits, and inside my house medical bag. You can grab one of these and have everything you need to treat most small to large wounds. Burns, lacerations, penetrating injuries, wound packing, sucking chest wounds, abdominal injuries, eye injuries, avulsions, or even covering amputations. I've changed items slightly from what I was originally shown. Don't hesitate to modify your gear or quantities to fit your mission or expected injuries. A medical provider in a combat zone will have different content needs than one responding to a little old lady lying on linoleum. I keep the supplies in Ziploc bags for protection, to keep everything together, and it allows me to remove what I need for treatment, close it, and stow till I need to use it on the next patient. You could vacuum pack your toss kit, but once opened, it's opened. If you do vacuum seal your bags, it might be a good idea to put a visible item list on the inside. This one is for my wound care tote, and will have different supplies than my combat ones. The contents of this one are 2 pairs of large gloves, 10 4x4 dressings, 2 Kerlix bandages, 2 4-inch roller gauze, 1 5x9 ABD pad, 1 petroleum gauze dressing. The gloves protect you from the patient's pathogens and the patient from yours. They also help keep you from transferring blood onto your equipment or rifle after care is given. If used in combat operations, you don't want bright colored orange gloves, but you also don't want black gloves, as body fluids or types of body fluids don't show up on your hands as well during finger sweeps. The 5x9 ABD pad stands for Army Battle Dressing and not abdominal pad as most people believe. If you only think of it as an abdominal pad, you will really limit what it can do. They're highly absorbent, so if you want a wound to clot, you should put several 4x4 dressings on first and then cover with the ABD pad. 4x4 dressings are the bread and butter of bleeding control. Given a large enough supply, they can treat most all bleeding. Military combat dressings are for the most part lots of 4x4 dressings with an ace bandage to secure it and provide pressure. 2-inch roller gauze is used to hold the dressings in place and provide some more absorbable material and put compression on a bleed. Kerlix can be used for wound packing, as a dressing, or to secure dressings in place like roller gauze. Vaseline or petroleum gauze can be placed on a wound first and used as a non-adherent dressing before gauze is placed on top. It can also be used for covering foot blisters and held with roller gauze. The dressing is occlusive, so can be used on an open chest wound to seal the injury and hopefully prevent a tension pneumothorax from developing. Be sure to check for an entrance and exit wound. You could also carry a small amount of Gorilla or other brand of strong duct tape for covering small wounds, blisters, or securing occlusive dressings. The medic toss bag is an inexpensive, simple to make force multiplier for the medics so they can focus on critical patients without having to stop to treat minor wounds that can be handled by self or buddy aid.